right. Good morning, good evening, good afternoon, depending on which part of the world you are. Today's another great edition of the Logan's Hour. We are back again. We had a little technical problem just now as we were on, so we have to reconnect. So those of you who following us here, you can go back on the Logan's Hour and see that we have reconnected. So we are here again. So we want to say to all of you, sorry for the inconvenience that occurred not too long. So we will go back on the various platforms and have the short one removed so you can right now join us as we hold on, let me hear myself again. That's the same thing I was doing just now. Yeah, I don't know what happened. It was just abrupt interruption. So we want to say again to all of you, thank you for joining us. And I'm sorry about that. I'm trying to go by my page and remove the 19 seconds video that was just being played here. So you know these things happen. It is what it is, and we will try to fix it another time. So remove that to trash because I know some poor thing. The show is not being on, so you can go back on the Logan's Hour and see that. Okay, it's clear now. Yeah. Well, I've been watching myself, so you don't think you see it at me, so I've been watching my I've been watching myself, so because me I know myself, I'm mirror looking son, mirror looking children and allow ourselves for my mind said the first way you can let anybody, you gotta first let yourself. If you let yourself, you can't let nobody. So that one is part of us. All right. So want to say to all of you here, thank you for joining us. Today we have a very interesting conversation that will be going on today. So uh, you know, like even CNN, BBC, and other bigger media platforms can usually have some technical difficulties. So we are no exception to that. And we have a few just now. It was a little confusing, you know, while we were on the show, and all of a sudden everything just went mute. We got muted and we try to fix it. It was a little problem, but I'm glad we are back. So tell someone to tell someone to tell someone that the Logan Hour is on. And right now, I know some people be like, "Oh, what happened to the show?" Yeah, the show is on. So right now, we are here about to get rock and rolling. So I'm about to share this show again in platforms that I shared in previously. So I'll be deleting those ones that I sent previously. So you can go there if you are part of those platforms and watch the program. Or if you here, if you can share the show, do a favor, just a favor by sharing the show. Your skin, nothing going to happen to you. You're not going to burn. So I'm trying to remove the ones that I shared previously, so other people who in those platforms can get confused as to which one is currently being aired. So today is another day, you know, and these things always happen. So we want to say to all of you, sorry for the technical problems, and our studio person were able to rectify that problem as quick as possible. I want to say shout out to my crew, shout out to all of you back there. You guys are doing an excellent job, and I'm glad we are back. So we were just trying to share the program as quick as possible. So if you can share the program for us as well, we will appreciate, because today is a very sensitive conversation, has to do with HIV and AIDS, and talk about everything that is happening within our dear country. You all know the prevailing situation, so we can pretend to 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 think that what is happening back home, we are no exception to it. We are part of it. So let's tell someone to tell someone to tell someone that the Logan Hour is on, and we're about to discuss some sensitive issues that have to do with the growing HIV and AIDS situation in our dear country, Mama Liberia. So today we have with us here one of our own sons, a very smart young man, Dr. Jeremiah K. Saylae, a pharmacist. So today we have him here. He will talk about what we discussed the other day. And it's gonna be a very interesting one to be part of. So those of you who would love to be part of this conversation, I can say to you today, get your coffee and don't go far. Get your coffee and just log on to the Logan's Hour and let's have this conversation. And I'm grateful. I'm grateful for all of you here, all of you. And some of you who continue, you know, sometimes when we're not on here, trust me, some people can call us and be like, hey, what's up? What happened to the show? I have not heard you for some days and blah, 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 blah. And, sometimes when trust me, we are human. When I slack for some time and I rather be giving those flimsy excuses, the person be like, one of the person who followed the show, I would be like, I understand, but I think it'll be good when you come on the show every time. I say, okay, that sounds good. But again, I want to say thank you. Thanks to all of you who joining us. The reason why I share this show both ways, usually I share this show via Facebook and I share this show via YouTube, is that some people want to watch it on YouTube, some people want to watch it on Facebook. So you can have your option to watch it by Facebook or by YouTube. Some people love to watch the show on Facebook, and some people love to watch the show on YouTube. So that's why I always when you see me, I share this show. Right now while we in this embryonic stage is when we be sharing the show. Every time we come home, we take up on ourselves, we grab our phone, we share the show. Man, everything has its own time and season. There will come a time where we'll not be sharing show again. You just have to go and look for us and know that okay, the looking hour is on 6 o'clock. We gotta go and find the lookings hour. Everything baby gotta crawl for baby wall. Imagine you come to your show instead of you focusing on the show right now, you gotta sit down and share the show in all of the chat rooms for everybody to know that you on. Yeah. You know. Now what they say the Egyptian you see today, tomorrow you see them no more. All right. So want to say thank you all of you for joining us today. Welcome again to the Logan's Hour. Today is a real great day. And going to be a real big show here today. We have with us Dr. Jeremiah K. Saylae, who's going to join us here. I see all the people who are watching for when the program went off. I see them joining us again. Precious Logan Samuel Titi, the Crown Ambassador, Honorable Zion Glad Chiayi. I see all of you guys are joining us again. We want to say thank you, and we are very sorry for the little slight interruption that occurred. And before I need to send a let me send a link right now to Dr. Saylae, so he can be getting himself ready. Then from there we will join. We will talk about some very interesting things today. A lot of people celebrated a birthday. Yes, today I have my dear little brother, Hezekiah Logan. He celebrated his birthday today in Liberia. Hezekiah Logan, happy birthday to you. Join me. Let's say a big happy birthday to this young, brilliant young man. Hezekiah Logan celebrates today. Hezekiah, happy birthday, and I wish you God's blessing. And also today, I also have two people that I truly respect. And this person and his wife, they are the very few people in this community that I truly admire. I see quiet love. Anytime I see that, I see love glittering in their eyes. And they don't do too much. So today I want to say to these two people here, Mr. and Mrs. Sion, I want to say happy anniversary to you people. May the true gods bless you guys and bless your union with more years to come. We are truly humble to be around and be part of this history. As you guys celebrate another year of marriage, I wish you guys all of God's speed. So, all right. So today we will have with us Dr. Jeremiah K. Saylae. You see, he's already on the screen here, and he will be joining us shortly. And Dr. Saylae will talk about the growing health concern in Liberia. Of late we talk about what was released by the National AIDS Commission in Liberia, talking about 36,000 people in Liberia currently live with HIV and AIDS. So today we're going to dive into that. We're gonna go more into that. We're going to ask Dr. Saylae the hard questions. Some of you following us here, I would love for you guys to be part of this conversation. Sometimes it gets to me where I'll be the sole person who would just ask all of the question. And I know some of you back there, you want to ask some kind of question. So that I know if I ask a question, the question don't go away. You can be like, yeah, I want to ask that question too. But it's a perfect opportunity though for you to ask a question. Ask a question. Post a question to me. I can still ask a question. That will not be a problem. I would love to ask whatever question you have on your behalf because it's a real, real, real sensitive thing at this point in time to talk to Dr. Saylae, to ask the necessary question. Let's pick in your head. Let's know what Dr. Saylae stands on some of these things in terms of the health issue, HIV and AIDS. It is alarming. It is alarming to have small country like Liberia and for us to start discussing 36,000 people who has already been down with HIV and AIDS. So while we have that Saylae, I would love for you people to ask questions. I would love for you people to ask questions. And I'm glad, though we are still growing, but I'm glad that you people can join this show sometime. I'm glad you people can leave your basic schedule to at least build your own community platform. Let's build our own community platform where tomorrow we can talk about national issues and we can become a help to so many people in terms of advertisement, in terms of so many things. So today I want to say with all due respect, I'm so humbled to be here as your lead host. As we have, if someone following me here right now would love to participate in the conversation and ask Dr. Saylae some of those basic questions, I'm also open to you right now. You can send me your text. You can send your text to 401-359-5072. You can send a text and say, hey, send me the link. I would love to sit on the panels and discuss the health issue and talk to Dr. Saylae and asking some of those hard questions. That will also be appreciated. So if you want to talk to Dr. Saylae as well, you want to ask some question relating to HIV and AIDS, come up here. Let's talk about it. Some of you are very, 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 very brilliant. So I can't sit down here and say, oh, I'm going to cast any expression on anybody as to the issues that is going on in Liberia currently relating to our health. It's very alarming. And I would love for all of us, when I say all of us, I mean you, me, and everybody else who follow this program and listening currently and has been listening to the issues in Liberia relating to our health. So I'm grateful to have Dr. Saylae. He just joined us. Dr. Saylae, you want to turn your camera the other way until you lay in one side. Yeah. So Dr. Saylae is already in studio. So some of you who following us, we have with us Dr. Jeremiah K. Saylae. He gonna talk about what we have been talking about. We just talked about it a few days, and it has to do with health. Most time anything that has to do with the specific issue like health, we'll talk to the health expert. When it comes to politics, we've had politicians. When it comes to religious affairs, we go and get the religious people. So today we'll talk to Dr. Saylae. He's a pharmacist, so he's going to talk to us here because the last time when we read the issue that has to do with the HIV and AIDS in Liberia, and those reasons were attributed to a few things. So we're going to talk about it. And don't forget, the health experts say health experts attribute gender disparity to a combination of biological vulnerability and social economic challenges, including poverty, limited access to health care, gender-based violence, inadequate sexual and reproductive health education, particularly among young girls and women. So we'll use that time to also talk about, to also ask Dr. Saylae about some of these things we are discussing right here. So Dr. Saylae, he's in our studio right now. We can see him right sitting. So Dr. Saylae, I don't know. You want to adjust your camera up front because I see you laying one side. So hold on, let me put that Saylae on the screen so he can see it. Said then he will better adjust. So those are you following us. We want to say we have this our young person here. His name is Dr. Jeremiah K. Saylae. He's a pharmacist. He just got a PhD just quite recently. So when he comes, he will better introduce himself. I'm now that person who is very verse in terms of using all of the jargons to describe Dr. Saylae. He's one of those people where you know him. He's an intellectual. He's a quizzer. He's a he's a debater. He's firebrand. You don't let nothing leave on him. So all you know, you can say, you might you don't take it easy with me. I get let you. I'll pay my there. All right, we pay my brother. Oh yeah. That is it. See it. So you want to turn your camera a little?
Let me see. I think I'm already.
Yeah, just put it okay. Yes, in landscape, but I think you are a little twisted. So that I said they're going to adjust just a second. So some of you following us there be like, oh my God, just relax yourself. So put in your comment, put in your question. That I said they're going to answer all of your questions. I would love for that I said to answer all of your questions. So we can. I see my own baby following me here. Netre Yeti looking. Netre Yeti. She's following us here as well. So all of you who following us here, I want to say thank you so much for following us. Which I see some people following us on YouTube. Oh, the YouTube getting hot now because YouTube. Before I remember when I had show, YouTube used to have very less people, but this time I see YouTube getting more people. Let me get small little aqua. Callistus can say it enter. Yeah, it enter. All right, so that I said it. Y'all hold on. That I said it going to adjusting his camera. He'll soon be here. Some of you who in the health feed, please put your question in. I will cue your question. I will save your question for you. So when that I said it come on, he can answer your question. So please, I see the Honorable Zion Glad Cheyi following us here, the crime ambassador. I see our current vice president, Mr. Richie Bodia Jr. You see, this is a very important topic. I see my own birthday man following us here, Hezekiah Logan. He said great initiative and awareness. Thank you so much, Hezekiah Logan. That Mr. Boya is also following us, the vice president. He said we are in class to listen to the data. Mr. Boya, just go and find your dictionary right now because you know that today he can't joke. He come in chunky. What the other guy need again? I mean, we said so. And only time I'll be begging him, every time he's trying to be words, I would tell him, say, hey, Papa, mama listen to you, my Oma listen to you. So for my Oma Bennett, the man will be here to break some of these words down for my Oma. Okay, somebody here following us on YouTube. The person said, thanks for being here. I'm here to help Dr. Saylae. Yeah, you can also ask in a question as well. So that would be very great. But if you love to come on the platform, send me the text. I will also send you the link. You can come on. You can be live in studio and also asking your question, and that will also be very, very, very great and interactive. So if you love to come on, you can send your text to 401 359 5072. So that is you join us by audio, so you want to put your video on. So this is it right here. You can send your text to that if you want to be part of the show. If you want to come on screen to ask a question to sit as one of the panelists, then you can also send your text. We're gonna send you the invite. You're gonna come on. Okay, that is it is well seated now and ready to go. So we're trying to read some of your comment who following us right now. So this person Robert said he ready to ask Dr. Saylae some questions. He following us by the YouTube. And he said, thanks to Dr. Saylae for making time to spend with the subject. Okay, that's good. Who's this person? Thanks, my blood be brother. That's good. All right, so let's see. Yeah, we have a lot of people following us from a lot of places. I see Netre Yeti Logan. I see my brother Rex Jusu following us here. I see J Tanu Gua Jr. Thanks, my big brother. Big brother, I'm proud of you, Dr. Jeremiah K. Saylae. Jeremiah Saylae, oh, you're from Liberia. So you get ready to hear your own big brother and friend. You're sending to school. Today, he come and punish you. Go back in your room, take your little dictionary, sit down with it right by you, because the man can go get who graduate degree. They can be telling you say, oh, there, no. So get ready. This is a well intellectual exchange, and today we are proud to have one of our sons, one of the best in our community. He's no one else but Dr. Jeremiah K. Saylae. My brother, sorry. I think I got you off the screen. Just a second. Okay, I got you now. Dr. Saylae, how are you today?
Hey, Phil,
Yeah.
I'm good. Are you hearing me?
Yes, I can hear you now. I can hear you very well. How's everything? How's life been treating you?
Just quiet, just quiet, man. Work and family. Yes.
Yeah.
Yeah, I had to use my phone because I was trying to use my computer, but unfortunately, I don't think I'm able to use
Oh.
that device. It make me flip upside down. So
Oh,
I
okay.
had to switch to using my phone. So I'm fine.
Okay.
As
If
much
that
as it,
works for you, then that's
yeah,
cool.
yes, pretty much.
Okay. That's good. That's good. All right. So now we are here. So we have a lot of people following us. It's already 6:43. So I've been having little technical difficulties. I'm trying to fix that before coming on. But I'm glad you're able to come on, and let's go into it directly. So tell us, who is Dr. Saylae before we can go into the conversation here today?
So Philip, I think most of your audience by far they know me very well. Uh, I'm a very vast intellectually. I'm grateful to God for that ability. Most people in a curriculum of science, they tend to be very introverts. I'm
Mhm.
glad to be one of the few guys who in a scientific arena that is able to engage both socially and academically and continue my scientific path. So, I mean, I'm like you say, I'm Dr. Saylae, but commonly known as Dr. J. It's the easier way my colleagues call me. So I came from the background of a Bachelor of Science in Chemistry with emphasis in mathematics and transition over to pharmacology and toxicology, mostly research based. And then I was able to pursue a degree in pharmacy and an MBA. And I've also contributed a lot in few publications in oncology. I did publication in oncology. I did a publication in medicinal chemistry. And probably right now I'm doing an independent research at the IU Department of Chemistry. I'm looking at some toxicity profile of some benzoacetyl compounds that I think I should be able to publish in a few months. At the same time, I also worked full time uh, and other things that I can dive into that I keep specific to myself.
Thank you so much, my dear brother. And thank you again for making at least the low 35 or 30 minutes available because, we discuss beyond the scene. You have some other engagements, so you won't spend the full time with us today. And we really appreciate it. So we're going to be very fast in dealing with the issues today. So let's just go straight to it. Over the weekend, we have these statistics coming from Liberia from the NAC, the National AIDS Commission of Liberia, and it was very damning. And currently, we have here 36,000 Liberians living with HIV and AIDS. The virus has climbed from 34,000 in 2024 to 36,000 in 2025. The NAC chairperson, Dr. Cecilia Nuta, confirmed. So what this mean if the virus climbs from 34,000 in 2024 to 2026? To 2025, they have 36,000. What's the attributing factors? Why it contributed to this increase of 2,000 so rapidly in just a year?
Um, there could be there's uh, several other factors that could be the reason, and one of the factors is the lack of education and significant awareness in the public health sector. Because with Liberia and the situation our country is faced with is a challenging situation. Medical practices uh, are they up to date? Are the staff trained medically? Are the people aware of the their engagement in their society? and some of their socio-economic characteristics and attributes? Are they aware of the consequences of their actions? I'll give examples. We have a lot of Zogos in the street.
Mm-hmm.
Suppose they are engaged into what we call RV drugs use or RV use, share needles among themselves to inject themselves with drugs. It
Mm-hmm.
could be one of the factors. It could be lack of unsafe sex. And the lack of unsafe sexual habits could be one of the major factors in the Republic of Liberia.
Mm-hmm.
And we all know that lack of medical care could be an issue. Sharing of needles and mother to childbirth. I don't know how often the mothers are tested for HIV before childbirth, and if they're given a red therapy or red medication during childbirth. So these are things we can dive into while we give our overall uh, introspect on some of the way we can mimic and minimize the rapid spread. Because looking at that number in 1 year is a 5.88% increase. It tells you statistically that one in every 17 person from the 34,000.
Mm-hmm.
Just looking at that 34,000 in 2014, I can analyze and say one in 34 person had a virus, and that's significantly high in 1 year in 12 months. That's not good for our country, and I see this as a national disaster. I see this as well as a national emergency, healthcare emergency.
Wow. Thank you so much for that. So the health expert attribute the gender disparity to a combination of biological vulnerability and social economic challenges, including poverty, limited access to healthcare, gender-based violence, and inadequate sexual and reproductive health education, particularly among young girls and women. And this statistic shows that of the 36,000, 24,000 of them are women. Why? Why is it? Why not men?
This is you got to understand the social economic complex of the Republic of Liberia. Uh, After I've dived into answering these questions, I would just like to give people the glance of what HIV is, because somebody just know HIV and AIDS, HIV and AIDS. They don't know the distinction. They don't know what is HIV. So I just want to give the audience a clear pictures of how they contact the virus and how they can carry some prevention therapy. But
Go
however,
ahead.
the
We would appreciate
issue,
it.
the question that you asked here today is significant enough because in Liberia, the men has the characteristic, they have the ability to have decent jobs. Uh, Most of our women are not working, they're not economically powered. So with that, what you're going to see is that they depends on their male counterparts to substitute most of their income. Our girls want to go to school. They have a guy or somebody around that can afford economically, and that could be some of the reason. So poverty is a serious issue in our country. People do not have the economical strength to survive, and that could be some of the reason. Some of the reason could be lack of education. Our girls drops out of school, primary education very quickly,
Mhm.
and they become vulnerable to society. So some of the thing is education, increasing female education. And Philip, you said something specific that 24,000 of that number shows to be female. Now,
Yeah.
that's tell us that if you look at it, that's tell us that that's a 66.67% increase. That's a very high number in one gender. So you can see there's no level of equilibrium between the male and the female gender. That's two times. That's two times of the male gender. Now listen, that tells me that every one male living with HIV, the equivalent rate is two female to that. So the ratio is like 2 to 1 right now. So as much as the male counterpart is 33.3% increase, the women are double to 66.67% increase. If we do not mimic that increase, if we do not limit or we do not find a pathway, an alternative route to limit the spread of the virus, then what we're going to do is that gender is going to increase to almost 87 and 90%. And we don't want that. What will happen is the level of spread of the virus will be multiplied in several counts in other aspect. Now, let me say something that I saw, because when I try to do a basic research on Liberia, the last report I found through United Nations Global Health System was 2016.
Mm-hmm.
And that's long, over 10 years. Every time they gave this report, they gave this report for media report, but there's no database that we can go and analyze the data to look at the variance, to look at to just calculate the power at which is to reduce the tab one and tab two error. That's
Yeah.
highly statistical. I could not find that data. But what I was able to do is I was able to think through the process and analyze few things. I look, few other things can be done to mimic this, because imagine the entire country is not tested. There are few people that was willing to get tested, and out of that they produce this result. And if a result is coming from an expert that Dr. Nutu,
Mm-hmm.
I will consider that result statistically to be 85% significance. The only reason I can consider that birth data to be 95% significant, because I don't know on what variance. Now I'll give an example, and this is a theoretical statistical examples. What I mean by that is this example of them saying that this is from uh, 34,000 to 36,000
Mm-hmm.
is true, but this is what happened. There is a discrete data set, meaning that when you count human being, you count them one, two, three. Human being cannot be 1.2, 1.5. So it's not a continuous data. So what's the possibility for you to have from 34,000 to 36,000 exact 2,000? What not 2001? No, not 2003. What not 2011 difference? So
That's
you
a good
see,
question.
they don't have an all ratio number. They have an even number. So what it tells me mathematically is that that particular number was approximated. Now,
Mm-hmm.
it could be approximated, telling me that that number could double more than what we are talking about. So
True.
we I didn't see any regression data. I didn't see any all ratio or absolute relative risk data for me to do my own analysis. So I theoretically analyze that from that point.
That's true. That's true. Yeah, I want to appreciate that too. So give us the background behind the HIV and AIDS. You say you want to give people the distinction. What is AIDS and what is HIV? A lot of people don't know that.
Yeah, Philip, thank you very much. So AIDS and HIV are different. But they only become different based on your CD4. And you always say somebody CD4, CD4. The CD4 is a type of white blood cells
Mm-hmm.
that you have in your body. Your body has its own defense system. So when you come in contact with HIV, what happens is you notice that HIV by itself as a virus is a single RNA virus. So when it comes in contact with that particular virus, the interesting about the HIV virus, it has an envelope, and that envelope has what we call a surface marker. The two surface marker on the HIV
Mm-hmm.
virus is what we call the glycoprotein 41 and either the glycoprotein 41 and the glycoprotein 120. Those are the two surface markers that bounds to the human being when they come in contact with the human being. Let's say I cut, and somebody with a HIV gave me that cut.
Mm-hmm.
That surface marker GP41 and GP120 going to bound to man CD4 cells. And man CD4 cells also have two things. They have CD4 and have a CCR5. But most time it's the CD4. Now, when it takes in that CD4, it comes in contact. It has to go what we call reverse transcriptase. So now the virus
Mm-hmm.
come in contact with me. Then it was an RNA. It have to go from RNA to DNA. So it makes double strand. When it makes double strand, then it will get into your body, and then it will go what we call integration. It will integrate, and then when it integrate, it will then transfer itself to transcription, and then it will be translated. So in the process of transcription, that's when both DNA, the virus DNA and your DNA now turn into messenger RNA, and then they turn into proteins. Now, one of the complexity of the human being, our human genomes, we make out of DNA, right?
Yeah.
So if we come in with a virus DNA and enters our bloodstream, we can't get rid of it. That's why they say HIV don't have cure. because I can get rid of your blood now. It's just in your bloodstream now. So it's
Mm-hmm.
multiplying. So what we want to do in that case as a clinician or somebody who is an HIV specialist, you want to decrease what we call the virus load, meaning you don't want a virus to keep multiplying in the body. So we want to mimic the virus and then we want to focus on keeping your CD4 count to be 500 to 1,000 like a normal CD4 because once your CD4 is tested and it counts below 200, that's when you get AIDS. So somebody can have a CD4 of 215, they are still HIV positive, but they don't have AIDS. Once the CD4 counts
Mm-hmm.
come below 200, then you have AIDS. Then you are exposed to other infections because your immune system is weakening right there.
Wow. Wow. That's a great one. I don't know if many of you following here understood what the doctor just explained, but you have the chance to ask a question in the comment section if you love to ask a question in the comment section. So the doctor just gave a real better explanation as to HIV and AIDS. So when it transformed from being an HIV to AIDS, and the reason why is it do not have a cure because it's formed part of your DNA. And you all know your DNA has to do with your blood, the deoxyribonucleic acid. So you cannot take
Yes.
all your blood from EU. So yeah, but you can take all your blood from EU. It means that is or you gotta live.
So you have to
Yeah,
live
man.
with it. You have to live with it.
Wow.
So
Wow.
so in that case, what you do
Mhm.
is I would say like when you hear people talking about prophylaxis, right? Pre so for those that treat HIV now,
Mhm.
you will see that somebody who is exposed,
Yeah.
you have pre-exposure and post-exposure. Post-exposure is like I will give an example. Let's say I was giving a patient vaccine and I poke the patient and the patient have AIDS for some reason I poke myself.
Mhm.
That's post-exposure prophylaxis. So what we have to do is right there, within 1 to 2 hours, we want to start you on therapy because we don't want you to for the virus to multiply. So we can stop it right there. Then the pre-exposure is maybe I have a partner that have HIV and I
Mhm.
don't want to get it and I want to keep my relationship with my partners. I can go through what we call pre-exposure prophylaxis. So you can give drugs like Discovery, Truvada, or drugs like Discovery, Truvada, and Aptotil. They can use that for prophylaxis. So you have a HIV partner and you on treatment and he can give it to you.
Mhm.
Then post you can still use Truvada. So these are things um, can actually limit people from spreading the disease.
So it's very possible to have your partner in the home and taking medication. Your partner do not have the virus if you are positive.
Yes, two ways.
Wow.
The first
Wow.
way is you go through the pre-exposure prophylaxis, like I told you,
Mm-hmm.
drugs like Truvada. Truvada is a drug that has a combination of few other drugs I don't want to go into because most of our audience they don't know the medicine. Even if I say it will be insignificant, it will be immaterial to our discourse. But Truvada, Discovery now, let's say you know overall generally, if you have a homosexual, let's say men having sex with men,
Mm-hmm.
um, um, is in the Western society that we are is one of the population that have high rates, right?
Mm-hmm.
So so when you look at that from that perspective, we use Discovery a lot with men having sex with men. Now let's go back to our Liberia because our audience is mostly Liberia. We don't want to focus on therapy here, right?
True.
So in Liberia, there are a lot of pressing, challenging issue. Can the affordability of the drugs is one of the challenging issues. So in
That's the
Liberia,
question I was about to ask you.
exactly. So in Liberia, what I will focus on with honestly, I would like to say public health awareness is of significance. It's highly of significance because if we can focus on public health,
Mm-hmm.
then we can mimic the transfer of the virus. We can mimic people coming in contact with the virus. We can make people attitude. They will practice safe sex. People will now be able to know and be aware of the danger that comes with contacting the virus. And two, we have to forget about stigmatizing people and
Yeah.
discrimination, because it's one of the big things in our society. People feel that once you have HIV, you're about to die. That's a complete myth. In fact, in the 21st century, the increase in therapy has made HIV people to live longer. While we should focus on it, that we should encourage the increase in testing, because what it's going to do there is that the sooner you know, the longer you live.
Mm-hmm.
Yes. So right
Mm-hmm.
now, government should increase the testing among people that contact the virus.
Okay. So we have my brother following us here, Ernest Mallison. He said, "How accurate are these estimated numbers, and what challenges exist in getting people tested and into treatment programs?"
Um, a very good questions. For me, I have a limited background in biostatistics,
Mm-hmm.
but I know from my research background, when I see statistical data, I know how to plot them all, because you can see the you can look at it, you can be able to separate the null hypothesis, which is the hypothesis that is correlated to experimental data, to that of the alternative hypothesis. In the sense of Liberia, it was hard for me to extract the data. I don't want to say maybe the data has not been exposed to the public,
Mm-hmm.
but I wanted to dive deeper to see some of the correlation in the variables. That is, in those numbers, I want to see the absolute rates. I wanted to calculate by myself the absolute rates, the relative rates reductions, and the number needed to treat and the number needed to harm. These are statistical analysis tools that I could use, but I could not extract the data from any resources. But what I can tell you is, I do believe, because the Dr. Nuti is very credible from her background, right? I do
Mm-hmm.
believe they have those data, but they are not making it to the public. So, okay. So, it's one of those things. It's one of those things we have to look into.
Okay. All right. So as a pharmacist, I honestly have another question, but I just want to ask you,
Mhm.
as a pharmacist, what role do pharmacists play in HIV and AIDS prevention and treatment?
It's a very big role. Um, it's a very big role, and most of the time we have specialty pharmacists for that. Uh, I have been opportune to do a lot of inquiry and work with them during my clinical days. I work at the HIV clinic,
Mm-hmm.
so I have a very uh, vast information on therapies, because I have to be tested. Now, let me see how we, as pharmacists, let me give you two or three of the roles they're going to play. Right,
Mm-hmm.
somebody contact HIV, the first test they come to do, they do the ELASO test. The ELASO test is a sensitivity test. When when we talk about test being sensitivity, I mean that the test is able to pick up that the person have this virus. Now,
Okay.
because HIV virus has synonymous symptoms to that
Mm-hmm.
of flu-like symptoms, so we have to do verification. That's when we do the specificity test, which is the Western blotting test. If that test confirm that the person had HIV, we as pharmacists now, that's when we come in, because we're now going to require them to do what we call the resistant testing.
Yeah.
In the resistant testing, there are two things happening in the resistant testing. We're looking for the phenotypic and the genotypic testing. The phenotypic test is going to tell us the mutation, which gene was acquired from the partner that gave it to them.
Mm-hmm.
So when
So
we do,
my all my following. So some of these medical terms, you might please help me to break it down.
yeah,
You're
that's what
talking
I've
about
been
the
doing.
mutation. It means changing from one state to another state. So, but I
Yes.
just want my mom to know what you're trying to say, because my Oma can be
Okay.
watching it on the TV to the
Sorry.
honest.
Sorry. I
Yeah,
will
go
try
ahead.
to.
Go ahead. No,
I'll
that's
try
good.
to. Yeah.
Yeah, that's good. My Oma following too. So I just tried to say
Yeah.
that.
So when yeah, like you said, when something is mutated, it means it has some alteration in the gene, because I
Yeah.
told you about the protein is one sequence of protein. Something
Yep.
happened there.
Yep.
So in that, then we can come to the pharmacist now. When we look at your resistant testing, we can see which drugs to go with, right?
Mm-hmm.
When I explained from the embryonic stage of our discussion, I told you the stages of the HIV. When it bind, it goes through fusion. From fusion, it goes through reverse transcriptase.
Yep.
Now, If you just had a virus, I can give drugs they call fusion inhibitor to inhibit it from going through reverse transcriptase. If it goes through reverse transcriptase, I can give what we call uh, 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 just I don't want to go into that NRTI and NSRTI. That's how we call them. We just call them as short mnemonics. We can
Mm-hmm.
block it from that speech. When we want to block it from multiplying from DNA to RNA or from DNA to protein, we can give you just the protease inhibitor. So imagine if you, as a pharmacist, another person cannot treat HIV patients because everybody respond to therapy differently. I
Mm-hmm.
can change a patient from a protease inhibitor to non-nucleotide reverted inhibitor drugs because they are responding. If the patient has sulfur allergies, I cannot give certain HIV medication to them. So that's where pharmacists play a role. Another role pharmacists play is follow up, follow up with patients, counseling patients on compliance and
Mm-hmm.
adherence to therapy. Because the more you comply with your therapy, you take your drugs every year, here's what happens. You're going to move from the status of you're going to move from the status of detectable to undetectable.
Okay.
Yes. So we have to keep encouraging each patient. You have to stay on therapy. We have to follow up with them. We have to counsel them. We have to look at the side effect of the drugs. Some HIV drug will cause uh, 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 fatty liver disease. Some of the drugs will give you what we call myopathy. It will give you bone pain. So when we receive those reports, we can try to streamline or optimize therapy. So
Okay.
that's the essence of the pharmacist being on a team.
That's good. That's good. So how can pharmacists and healthcare provider work together to raise awareness?
It's what we call interprofessional relationship in healthcare. That's when we getting it from the technician, from the lab,
Mm-hmm.
giving us the actual report to the clinician communicating with the nurse to give care. Now, you will see that mostly with AIDS patient. Because with HIV patient, they're taking the therapy, they're going home. But when somebody have AIDS, they have what we call opportunistic infections. They have
Okay.
different infections coming in. Some of them start having candida of the mouth. Some of them have something we call PCP. Some people start having what we call meningitis, inflammation of the meninges. That's
Okay.
when the nurses come in to start giving their bedside care to those patients. That's when the pharmacists make sure some of the. I will give an example. Let's say a mother have HIV and she come for delivery because normally when a mother have HIV and we don't want it to pass through the placenta to the child, we
Mm-hmm.
put the mother on three different medications. We put them on three different medications through our therapy. But when she comes to give birth, we give her a specific drug called Zadeverdin. We run it through her IV and we dose it by 2 milligrams per kg. So we look at the weight and we dose it. Then we run it for the few hours. Then we put her on the 1 milligram and then run it for 24 hours till she give birth. And then when she give birth, we continue Zadeverdin in the baby for like the baby start taking the dose for 4 to 6 weeks so that the child cannot get the HIV from the mother. So that's why I say Liberia is a high risk and it's a national emergency in public health is a concern because how many hospitals can afford a judge everything to put on a pregnant woman that have HIV? So the likelihood of the child getting the virus through the mother is high in Liberia as well.
Hmm. That's a
Yes.
real one. That's a real one. So if you're just joining us, we are on the Logan's Hour. We are here in conversation with Dr. Jeremiah K. Saylae. So if you don't know where you are, today is Tuesday. And all right, so we are back again here. So Dr. Saylae is in our studio. So we're going to ask him some of the questions. He answered most of the questions here already, and he will not be here for too long. He told us at least 30 minutes of his time because he's very busy today. So Dr. Saylae, I think you have answered some of the questions, but I have Mr. Ernest Madison also following here. He asks another question, and he asks this question. He said here, what's his second question here? I think I queued both of them. He said, how does stigma surrounding HIV and AIDS affect prevention and treatment efforts in communities like those in Liberia?
Yeah, it affected to the very high degree. This is the reason why. If somebody is stigmatized, they don't want to go to the HIV or AIDS clinic. They don't want to go for testing because once people see you going to the clinic, even if you're just going for testing, they're going to say you have HIV and they're going to spray you very well,
Mhm,
fast in the community. Secondly, a lot of people think that once you have it, you're about to die. In these kind of circumstances,
mhm,
people want what we call society support, community support. And I must say this vividly and not to be arrogant about it. Liberians are one of the people that do not actually give support to people in HIV crisis. We stigmatize them, we look down at them, and this you got to look at it from this way. The same reason why they have HIV, we all do the same thing, but some people do it at the extreme. You know, we have all been exposed one way or the other. We have gone to the barber shop, somebody had cut our hair, and we don't know if they use the same blade on you or they use it on me. Some of us have had tattoos on our skin. We have gone to the tattoo shops and we are being exposed to needle, and we don't know the tattoos artist, the kind of needles they are using. We have gone to the hospital and somebody have given us injections and needles. We all have been exposed one way or the other. So if somebody is in such crisis, we as a community should provide a significant support. But in Liberia, people stigmatize you, and that lead to what we call the degradation of the person health, because the person start worrying, they start being stressed, they start being isolation, uh, uh, they start hiding from society, and some people commit suicide. That's what it is very good to talk about. Discrimination and stigmatization is very bad, and we should. And the only thing that can stop that is awareness and education. We have to tell people that look, somebody can have HIV and do the normal job. Somebody can have HIV and stay moved around as long they are taking the antiretroviral therapy, as
mhm.
long the virus is being suppressed and the CD4 count is high, they should be good. We should give them the opportunity. I'll give you this. There are a lot of people living with diabetes. All diseases come in different circumstances.
Yeah.
They own diabetes medication for the rest of their life. Diabetes hits every part of your body. It hits your kidney, your renal system, your your heart. Everywhere can be affected by diabetes. But people believe that when you have HIV, that's the end of the world for you. There are other diseases that people have. Somebody can live with HIV for 30 years and somebody can come down with stage 4 cancer. What's the differences? You can be healthy and laughing at somebody with HIV, and next time you get diagnosed that you have stage 4 cancer, and you will go before that person that have HIV. So we should encourage people, that look, though you have this disease, you can live as long as you stay on therapy. And that's where counseling and all these social worker comes into place, and this clinician come into place to counsel their patients. You got to show empathy, no matter what the circumstances. And for me, I'm glad in the profession I'm in. We talk a lot more in our profession about empathy because we are the hope for our patients. And I think we should share these words to our people in Liberia that as much we want to discuss limiting the spread of the disease, limiting the spread of the virus, we also want to encourage our population to give community support to these people. Because if you're giving somebody the support, they will take their drugs, they will take their
Mhm.
therapy, they will not have marriage. But if you stigmatizing the man will just move to one different location and start spreading the virus out of anger. You see what I'm saying? So you have
Yeah,
to create education for these people.
that's true. That's true. And we got another person following us here by the name of Robert. Robert question is, good afternoon, brother Logan. My question to my brother Dr. Saylae is, why is it very important for our people to get tested for HIV? Thanks, brother Robert.
Things it will help us both nationally and internationally because the more people get tested, the more you can actually get the true number, the true value. I think Fede mentioned it on his last show when I watched it. He used a particular phrase. If my Mandula can tell me right, he used the example of sample size.
Mm-hmm.
In every research, if you have an adequate sample size, the larger the sample size, the more you can get the true data, the true value of how more people get the test. Imagine, we don't know how many people were tested for us to know that 36,000 people got that. So
It's
the
true.
more people we test, the more we're going to see the number we're going to increase. Now, the more people tested, we can do what we call geographical profiling. In that light, it will be more of knowing that, oh, the disease is faster spread in West Point than Nikuta.
Mm-hmm.
So people that are relocating from West Point to Nikuta, we have to tell them, no, we have to check and be able to relocate which part of Nikuta they're moving. You can be able to profile where HIV is fastest spread, where's the pandemic starting. You can analyze the prevalence rate and the incidence rate from that point. Secondly, when you increase testing, you know how to carry on therapy, meaning you can be able to see how many people have had a disease in 1 month,
Mm-hmm.
2 months, 3 months, and you can start therapy as soon as possible. And increasing testing, one thing it's going to do is it's going to give the government an insight of how much antiretroviral drugs we should bring to this country in terms of logistics and finance. How much in terms of budgeting we can get these drugs. If it's United Nations supplying these drugs, we can be able to tell them, look, in a month time we need this quantity of drugs to give to our people, you know, and stuff. And one of the things our country Liberia needs, honestly, I think we need subject matter experts. Not everybody treat HIV and AIDS. There's a lot I can tell you on the screen, and that's where pharmacists play a pivotal role as well. So
Yeah. All right. Let's get one for our brother William. Then we'll come back to Ernest Madison. Because I know. Let me know if you will be leaving. How many more minutes we got? Just send me in our comment section. Don't announce
I
it
will,
here
I
so
will,
I
I
can
will, I
know.
will, I
Yeah, because
will.
I can see you now. I can tell that. I mean, I
No, no,
think
no,
I
no,
hear.
no,
Okay.
no.
So that
I did
take.
a few times.
Okay, that's good. But you send me some graphs. I don't know if you want to talk about
Yes, I want to talk about
yeah,
that
because I
because
want to talk about the absolute increase, the fractional increase, the percentile
okay,
increase, and all of that. You send me that. So I would love for yourself to explain it. So let me
okay.
just okay.
Can
If you're
you,
ready for
can you,
that.
can we
uh
go off so I can log on my computer because your screen is small from my phone?
Okay, so
Yeah.
yeah, you can go off and because I
Okay.
got it, I can also put it on the screen. But if I put it on, then you won't be able to see it better.
Yeah, I
So
will look at it from my dashboard. Yeah, so I'll be looking at your screen and talking.
okay, that's good. Then you can go off and just connect from the other side. All right,
Okay.
so the data will be right back. That is going to be right back. He's going to log up now and log on his computer. I see questions coming. People are interested. Those who have their loved ones and everybody back home, they really want to know what's happening. This thing here is serious. Now, one man thing, this thing here when HIV grab anybody from your family, I always say this. Looking at Ebola, Ebola time we had a little joke. We used to say, we used to call it family DV. It grab one, it will carry all. That's how HIV almost look like. Imagine you living in a house with someone who have AIDS. Not they're living from the HIV level now. Because the HIV level, he say you can also treat it. It's curable. But if it reach the AIDS, it has no cure because it's in your DNA. It's in your DNA, and when it's in your DNA, you can subtract it from your DNA because it's part of your blood. So now that is it. That is it. If you're ready, just give me a thumbs up. I'll. Okay, he ready. Okay, that is it. Is back. All right, he back on his computer. So you are muted. You are muted. That is it. Can hear? Can you hear me?
I can
All
hear you now.
right. Okay, he can hear me now. So if you're ready for me to put that on, I can put it on. But before you can answer that, let's hear from this person here. This is our brother William. William say hello, Philip, and my brother Jeremiah. Just wanted to know if HIV patient is on the medication and get and can spread the virus to others. What if the person got caught with a blade and someone else uses the same blade and get caught? Can that person contact the virus even if the HIV patient is on medication?
Okay. That's a very significant and important question. And that's, I'm glad I William asked that question. And thank you for your question, William. Because I think William I probably hear about this and he want a clarity on it because a lot of us make that mistake. One, I would
Yeah.
say this because you have HIV on medication doesn't mean you can spread the virus. You can still spread it even if you're on medication. But this is what happened. If I'm on medication for a while
Mm-hmm.
and my status was detected because you have to be detected to say you have HIV. And then you go back in the clinic and they test you and they say, oh, you are undetected. You have here people have those myths, say, oh, the person was having HIV, then they don't get HIV again.
Mm-hmm.
And not true. The HIV is still there. They are just undetected because the test that we use, the ELISA test, is showing that the sensitivity of that test cannot pick up that the person have the disease. Now, that's the goal for country like Liberia. The people that have HIV, the 34,000 want to see how many people can take from detected to undetected state. That would be my first approach to those people. Now, and the only way we can see that is to look at the CD4 count. If the CD4 is less than 200, we know they have AIDS. So we'll just be managing the symptoms. Now, so if you have HIV
Mm-hmm.
and you are still detected and they use blade on you and at the same blade cut me, you that get in contact with the blade, the second person can get HIV. If the individual is undetected, then you will not have HIV. But you that just got caught, you don't know if the person is detected or undetected. So it will be better for you to go test and start what we call immediate prophylaxis, which is prevention therapy. That's when we give you Truvada, Descovy, or the new one they just produced, Aptitude. Now, people who are being exposed, the people that do commercial sex,
It's true.
what we can call, excuse my
Prostitute.
expression, prostitute, people
Mm-hmm.
that do commercial sex, RV, Jones, Young, street people that jump from man to man, woman to man, unprotected.
Mm-hmm.
They uh, they produced a new judge this gone June of 2025 by the name of Yastusgo. I can't remember the name, but it's I think Yastusgo. You take your injection 2 times a year for prevention and prophylaxis. FDA just approved that particular drugs. Now, so I hope I answered William's question. If you have
So
HIV,
so when you take the drugs, then what happened? You
okay,
can't
if
come
you
in contact with the virus?
yes, that's prevention. So
Oh,
if you
that's
if it's if you that's why I say like bro don't have those benefits. Let's say if you prostitute
mm-hmm.
and you know that's what you're doing for commercial sex, you start taking your once a month injection with either Discovery, Truvada, because there are other things we got to check before we give you those drugs. So when they're taking those drugs, they go in, you can get it, it's rare, but the
Mm-hmm.
percentage of you contacting HIV is going to be low now because you're taking the drugs for prevention prophylaxis. That's what we call pre-exposure. You know you're going to get exposed one day. So since
Mm-hmm.
I'm doing this for prostitution, I'm doing commercial sex, let me be taking my injection every month so that when I come in contact with this, it can be able to stop the virus from spreading,
Oh, okay.
from me contacting it. Yes.
Yeah. That's good. That's good.
Yes.
So we can go to our issue now, but I have one last question from Ernest Madison. If you would love
Okay.
to answer that question before we go. Ernest
Sure.
Madison is saying if someone is diagnosed, what are the current treatment options and what is the outlook for people living with HIV today in Liberia, especially with the public health factor basically seems to be a contributing factor to this gender disparity. What kind of interventions are needed?
Yes. I think Madison is jumping ahead of us. I think you get the
Yeah,
interventions pretty right. So I will now go into the intervention
yeah.
right now.
So okay.
But there are a lot of drugs. There are a lot of drugs in terms of medication. There are a lot of drugs on the market. My
Mhm.
only fear in terms of medical practices, in terms of therapeutic management for Liberia is that are the people that giving the drugs subject matter expert. I will give an example. Maybe somebody have an HIV drugs like we have one like Rapavaron, we have drugs like emtricitabine. They have variety of drugs, right? But because I have access to the drugs, doesn't mean the drug is good for me.
Mm-hmm.
The person I contact the disease from, if they are resistant to that drug, I'm not supposed to give them that drugs. If they are allergic to sulfur, I'm not supposed to give them certain HIV drugs. Now, in Liberia, are there systems for us to do resistant testing and know which specific drugs? Do they have all of the drugs on the market? I don't know. I won't tell you. I don't want to assume. So I don't know if medical practices are genuine enough
Mm-hmm.
uh, that we can see. Because maybe in GFK, for example, I'm not trying to say that GFK do that now, but let's say for
Yeah.
GFK example, they only got one HIV drugs there. Maybe they get emtricitabine there. They don't have protease inhibitors there. And this person needs protease inhibitor. So once they say, oh, you got no HIV, then they just grab the clinic, just grab emtricitabine and give it to you. That's wrong. That's wrong. We have to do resistant testing and see if the patient is resistant to emtricitabine before you can give it to them. I mean, before you then you can get an alternative. If not,
Yeah.
then you give them emtricitabine. So stuff like that are significant for us to look into.
That's good. Thank you so much. So, if you just joining us, you are on a Logan's Out, and we are in conversation with Dr. Jeremiah K. Saylae. He's a pharmacist, and we are talking about the current data that came up from Liberia that has to do with the HIV and AIDS ratio, ranging from 2024. We have 24,000 people up to 2025. We had 36,000 people came down with the virus. So 35 to 36,000. So, all right. So you want us to go straight to the PowerPoint now? All right.
Yeah.
So let's get the first one. Which one you want me to pull up?
The first one, the one with the 2024, 2025 that we're looking at.
Okay. 2024, 2025. So will be this one. The absolute
Mhm.
increase. Okay. Yep.
Yeah, so that data set, it was just something I did mathematically. It's a general elementary mathematics. It's not a big deal here.
Mm-hmm.
But I wonder for people that um, have visual to be able to look at that data. The absolute increase tells you that the new value minus the original value. What was the original value? 34,000. So it tells you that we have 2,000 increase. And that's
Mm-hmm.
based on the numbers that they give us.
Yep.
Yes. So when you look at that, you will see the fractional increase. The fractional increase, I want to know, okay, significantly, I'm looking at 34,000 in 2024. What fraction, what proportion of our data, it tells me that in one in every 17 people is getting the virus.
Yeah.
So the percentage increase is telling you that it's increasing at a 5.88% per year. Now, if we do not manage the disease, that increase in terms of percentage will go up.
Hmm.
Yes,
That's scary.
yes.
That is so scary. So what about this one?
Okay. This one most talk about the proportion of HIV cases in those who are women, right?
Mm-hmm. Mm-hmm.
If you take 24,000 over 36,000, you go 0.66 in terms of decimal. So then in terms of percentage, it tells you women are a higher rate by 66.67%.
Mm-hmm.
So the ratio of women to men in 2025 is 2 to 1 because then it tells me that men represent 33.3%. So the plot, they're telling you that women is at an increasing rate of contacting the virus twice, 2 times more compared to men. That's just what I wanted to display.
Wow. Wow. So let's go to the last chart of it here.
Yeah, this one is smaller, so let me put it on my bigger screen.
Yeah, yeah.
Yeah. So this one was answering Ernest Madison question. That flow chart I did that for maybe Philip can share on his platform for
Mm-hmm.
people to look at it. This is specific. I look at it from the global and national HIV prevention care and treatment guidelines with standard operation procedures. What will you do in terms of HIV care and treatment service? For the Republic of Liberia, looking at the factors in terms of providing clinical knowledge to our people, what I did was I limit this to Liberia now. I say, you know what? What is good for Liberia? Education plus initiative. What is the education? Let's give me 1 minute. Yeah. So Sorry, my colleague was talking to
Yeah,
me.
you're good. You're good.
So, uh, in terms of that, education for initiative, public health emergency. If I was in governance and I was working at the Ministry of Health, I will declare HIV as a public health emergency. Then I will increase, okay,
Go ahead. Go ahead.
I will now increase what we call public health awareness, and then I will increase testing, and I will increase my community pandemic response system, meaning we have people to track the location of all of these people to check on them regularly that they are not moving from one location to another. Then, in the major center backs, where all of the arrows are pointing, is where HIV care and treatment services I will provide. So I will provide counseling and testing service. I will provide antiretroviral testing services. Then I will provide services for opportunistic infections, like meningitis and other things that can come. That is when somebody have the CD4 less than 200, you will see that coming a lot. I will
Mm-hmm.
provide TB services and I will provide vaccination services. Let me focus on vaccination. Um, I don't want to say I know and understand the Liberia vaccination system, but we have poor vaccination system. People don't take vaccination. If somebody has HIV, all of these 36,000 people that have HIV, they should not. Once you have AIDS, your CD4 less than 200, you should not be taking anything I call live vaccines. And what are live vaccines? Live vaccines are measles, mumps, and varicella vaccine. Um, Vaccine, the type of vaccine you can't give it to AIDS patient because they already immunocompromised, and those vaccines are made out of different genomes that we don't want to go into. The biology of AIDS is complex.
Yeah.
So you don't want to give certain people vaccination, especially live vaccine. It can be given HIV patient, but not AIDS patient. So you want to clean that. Then you want to focus on STDs infection services. Then I will try to eliminate the elimination of mother to child transmission services. I
Transmission
will focus on it.
services.
Then I will focus on palliative care for those that have been admitted for AIDS. Now,
What is that? When you say palliative care, what that means?
when a person start having severe opportunistic infection, they start having something that we call PCP, meningitis. There's one day when your CD4 count is less than 50, we call MAC, which is a
Mm-hmm.
microbacterial avian complex. We call it MAC insans. So those are infections that come where you sometimes you see that your skin start getting rashes, they don't go away. Common flu, your immune system has broken down. You start having other symptoms adding on to death. So we have to
Okay.
give palliative care. Sometimes they're in pain, you have to give them opioid medication, other pain medication, depending if the person have fungal infection, you want to give them drugs like ketoconazole. That I don't want to go into other things like that. So that's why we provide palliative care. And those care comes at the end when you know that the patient will not make it, you know. So you want to do that. So all of those services have to be placed, they have to be put into place holistically, from counseling to testing, all the way down to that triangle. Now, in doing so, and to be successful, you have to have the human resource capacity. You have to have clinician, you have to have medical doctor, RN, PA working, counselor, pharmacy technician, constantly testing to increase testing, laboratory results coming all time, lab technician. Then we go into the finances. The finances, you have what we call internal quality control finance, external quality control finance, and the budgeting. What I mean by internal, let's say if you have a clinic in Liberia,
Mm-hmm.
the number of people that are buying the antiretroviral therapy, that are buying the drugs, we have to know how much people buying the drugs and how much it's costing. And then the external quality finance is any third party that provide or help. So maybe we're getting help from NGOs. We want to know how much is themselves spending to streamline therapy. So we want to also streamline our budget. Then the pharmacy services, we want to focus on drugs formulary. I discussed this in passing. What do I mean by drugs formulary? The specific drugs for specific patients. I'll give an example. The drugs we give when a woman has HIV and she's pregnant.
Yeah.
That special formulary we have to have for them. When a patient has a CD4 count less than 200, they are exposed to opportunistic infection. So if it's PCV infection, I want to give them Bactrim, which is an antibiotic. So I want to have formulary for that. Then I want to also in my pharmacy want to have what we call functional antiretroviral tracking system. I want to be able to track how much drugs they are putting out there. I want to also carry on procurement and supply management. I want to focus on specialty pharmacists for medication therapy management. We have to have pharmacists specialized for that purpose. Then we also have to focus on what we call laboratory services, lab equipment, lab SOPs, the number of reagents we're doing for testing, the internal and external system. Then you go to what we call physical infrastructure, counseling, clinic, pharmacy, laboratory, uh, clinical diagnostic kit, your computer, your furniture, your sanitation, electricity supply. Then you go what we call health record and reporting system. Philip, this is important because Liberia do not have a health record system. I went to Liberia. I was in a GFK, and somebody comes to hospital 1 week ago. They come by, they ask them for their name, their date of birth, and everything, and they tell them the person had to explain. 2 years ago, I came here, my stomach was running. Then 6 months later, I came back, my toe was swelling. They don't
Mm-hmm.
have patient records.
Yeah,
So we have to develop a way, even if we have a paper record based on date of birth, that when you come, we can look for your date of birth, look for your last name, and put it in the folder on the shelf and say, oh, Fede was here 2 weeks ago, and Fede was tested for this, and this is how these are the therapy we streamline for Fede. That way you can see if the drug's working or the drug is not working, or if the patient is on treatment compliance or not, or the patient is adherent to therapy.
I
Like we
agree.
don't have that system.
I
So I
agree.
focus on that bigly, like medical record system, monitoring and evaluating health information management system. What is the goal of all of this diagram you're looking at the screen? My goal here is my outcome that you look at here. My outcome is telling you that you should reduce the rate of HIV infections. You should eliminate stigma and discrimination, and you should focus by final goal for those that have the 36,000 patients that have HIV right now. Our goal is to reduce the rate of the infection, and we want to go for undetectable is equal to untransmittable. Thank you.
Thank you so much, Dr. Saylae. That was a real clear explanation. So I think, Ernest, your question has been answered. Your question has been answered. So if anybody else don't have any question again, then I'll ask Dr. Saylae my last question because I know he has to run. Today we have this discussion. So Dr. Saylae, my last question would be, I think Ernest already asked the question, but you
Yeah.
already answered this question, so no need to ask the question. So I would just ask you for your advice now in terms of what is going on in Liberia. So, as a pharmacist, what better advice would you give to people living with HIV and AIDS in Liberia or to the Liberian government?
So I would say this. Those that are living with HIV is I bear the pain. It can be very traumatic. It can be traumatizing. Um, it can be discouraging.
Mm-hmm.
Some of them is the livelihood conditions. Some of them is the situation, the poverty, like we said. Some of them is the early drop off from school, lack of education, all of these things. No matter what it is, God has a plan for everything. For me, I'm in a scientific arena, so we believe that one day there will be a treatment for HIV because scientists continue on discovery. They never quit. Even 200 years, somebody believe that one day a discovery will come. So people that are living with HIV should stay on therapy, should follow up, should limit uh, the spread of the virus, meaning they should not spray with other people. They should be true to themselves, and they should take courage that this is not the end of the world. They can still live and they can still be successful, whatever they're doing, but they should stay compliant, follow protocol, and adhere to therapy. That would be my encouragement to them. And to the government of Liberia, the government of Liberia had a bigger task at hand. I don't want to sound political, but
Mm-hmm.
politicians are one of our problems in society. Uh, with this kind of issue, the increase in budgeting for health specific to HIV should increase. If I was a minister of health now, I will be demanding, I'll be advocating for that increase in budget so that we can be able to get all of the necessary infrastructure and logistics to limit the disease. Now, compared to global statistics,
Mm-hmm.
Liberia is still better. Liberia is only
Yeah.
0.9% compared to global statistics. But because you're better now and you cannot control it now, trust me, you could fastly pass those that are ahead of you. And we don't want that. So the government of Liberia had a tax, they had a responsibility now to see how they can fund the hospitals and clinics. They even have to have a specific HIV trained clinic, if possible, specialized in HIV treatment. You don't
Yeah.
want to do general treatment with general hospital. You want a specialized entity that can care for these people. So I
So
will
just
encourage you,
squeeze,
Dr. Gabon.
just squeeze it in before you can leave. What advice will you give to individuals who are hesitant to get tested?
I mean, I always say testing is the best way out. It's scary. It's scary to get tested. But who don't want to live? Who don't want to
Mhm.
live?
That's my point.
If you,
Yeah.
I mean, we all like laugh. That's the reason I always say get tested. Look, rather you know than don't know.
Mhm.
Because I will tell you that the person that know now you're laughing at could live the next 25, 30 years. The person that
Yeah.
don't know could die in the next 5, 10 years. Because if the virus increase and you have high viral load, meaning the virus keep multiplying, and your CD4 is dropping, and you don't know, and you think you fine, it will take a common cold to kill you. Common cold will knock you down. But the person who's taking the treatment and know, they're going to live longer. So testing is scary, but it's the best alternative. So even we that in the United States, we should know our status. I
That's true.
encourage us to know our status now. Before, if it's really scary for you to get tested, you don't want to do public tests,
Mhm.
we have two type of tests you can buy from CVS, Walgreens, or the counter. They have the home access HIV-1 system test, where you can poke your finger, you send it through the mail, they do the test in 3 to 7 days, you find it, or you do the oral quick test, which can come back in 20 to 40 minutes. So that when you put the swab in the solution, you
Mhm.
yourself you carry in your bag, you hide yourself in your closet. You do that one when you see one line of pregnancy. Oh, then you be happy. You celebrate. You eat good rest. When you see two line positive, then you cry by yourself, and then you
Yeah.
seek your doctor and seek therapy. So you can do these tests at home. We are in the
You're right.
United States. We can do the
You're right.
test at home, so you can still do your test and know your status.
Hmm. Somebody have a scary question, but anyway, it's not scary as it is. It's just the person want to know because a lot of people the same question the person asking, a lot of people want to ask the same question. The person question is if you have HIV or AIDS and you don't know how long can it last in you before you die.
Okay, the longevity, the longevity of that is not well known. There is the reason why. Think about it is maybe I already have diabetes.
Yeah.
Or yeah, so I could be healthy, no problem, no comorbidities. I don't have no comorbidities. I can't contact the virus. I can still live 5 to 10, sometimes 15 years with the virus going around. But if you're on therapy, you can live longer than that, right?
Hmm.
Fine. But then if somebody who have pneumonia, who have pneumococcus, who has typhoid, who has malaria, any of those things, and they're living with the virus, they don't know, their immune system is going to break down. They're going to be immunocompromised very soon, very short. And when that happens to them, they're
Hmm.
going to die as soon as possible. So it's based on some of your medical conditions that you already have before contacting the virus.
Oh, so the
Yeah.
person longevity varies depending on your medical conditions.
Yes. Think about it this way. Yeah, I mean, if you have a bad medical condition, you're going to because everything you counter your immune system for fight against it. And the CD4 we're talking about is a
Hmm.
type of red blood cells that we call that come from specifically the T lymphocytes, red blood cells. So that's a whole immunology problems we don't want to discuss. But that's the main reason you want to protect your immune system. So with
Hmm.
HIV, your immune system is constantly fighting against the virus, and then you have other diseases that are also hitting your immune system, you're going to come down very quickly to death. Then somebody who is healthy and only have HIV and they don't know, they can still be living longer too because they don't have other immunocompromised diseases.
All right. So another question on my phone here, but I think the people got to take the children from side of the phone. This person asking, what if I go out and I I decide to be unfaithful and in the process of using protective material and it got bursted, and I replaced it and came home. Should I go out with my wife or should I? What she saying? Yeah, should I get tested before going out with my wife?
I would say get tested before going out with your wife. I will not advise you to go out with your wife. So if you get a virus, the both of you in the house get the virus. And if your wife don't know, you don't know. Maybe your wife will be cooking, she caught herself, and the little child around, the little child to get in contact. And sometimes the women behaving the children, they rub away, and something could just come in contact with blood or any
Hmm.
other thing, and the children all get infected. So it's,
Yeah,
it's, it's, it's not always going to be like in America, we don't get caught easily like that. You can be behaving your son, something happen easily. But let's say you are doing something and it burst and you
yeah,
replace it. I mean, your semen or vaginal fluid or rectal fluid has come in contact with each other. And I would say the first thing you do, you go to your, if I was in that situation, the first thing I would do, I would go to my doctor within less than 24 hours and ask for prophylaxis therapy again. We come back to Truvada, Descovy, and the other drugs they call Apretu. We come out of those jobs. So what your doctor will do quick, within that 24 hours, he will put you on those uh, pre-exposure prophylaxis medication, one of them. Then he will say, come back in maybe 2, 3 months to get tested. And then when you get tested, you got it. Then you can be able to communicate that with your partner. But you don't want to come from somewhere something buzzed, then you come again and show you who your partner. That's wrong.
yeah.
That's not good.
Well, thank you so much, Dr. Jeremiah Saylae. It was a pleasing pleasure to serve your community once more again. We truly appreciate your expertise knowledge when it comes to the HIV and AIDS awareness. And we look forward to having this conversation again, not just on AIDS, but any area of your expertise you love to share on. Because the next one I want to talk about, it will not be today, is this other one called herpes. People talk about herpes. Some people say it has no cure and some people don't know about it. So I would love for us to set a date again and have a dinner conversation on that as well.
I mean,
Then we
I'm
can.
always open. We can play in the next 2 to 3 weeks.
Okay.
December had how December is crazy for us now, right?
Mhm.
So I would say we can do that in the next 2 to 3 weeks.
Thank you so much. Because me, I have my own husband by house. Also December people. This is
My
December right
my
here behind
my
me.
my
My wife
daughter
that
behind you
December.
spying. She's
She
just
have
spying.
her own show coming start at once. She can't give me chance. You know her own show that pre-recorded show. Then we just record her show
Oh,
and be saving it. It's called Fun Time with Zora. This is where is it? Okay. That A right there is called Fun Time with Zora. So that what she waiting for right now. And usually when I feel my shoulder, she come on my shoulder and do us.
I see.
Yeah, man. And when she hanging around me here, she can give me a chance. Zora, your show will come on shut though, okay? All right. We still be
That's
on you.
that's
So
good, baby.
that is it. Thank you
Yes.
so much. We truly appreciate you, brother. So we look forward to seeing you again. So if there's anything you want to add, or if not, then we can say, bro, good night.
I would say thank you for the show once again. I appreciate you always creating a platform for us, whether political, community wise. We in Indiana we are blessed actually to have a platform that we can always go to and share knowledge. This is important for all of us. And to those my viewers that watched, I want to say thank you for your question, thank you for your encouragement, thank you for all of your listening ears. And
Thank
I want to leave you with this.
you.
If you're the only smartest man in the room,
Yeah.
then you should
Yeah.
leave the room or change your friends.
It's
Thank you.
true. Thank you so much, Dr. City. I like that. I like that. And I heard that from the late Dr. Miles Moreau as well. All right, man. Thank you so much. So, ladies and gentlemen, thank you so much for joining us here. We had Dr. Saleh in our studio. And now we're about to end the show here, and we have this my little princess right here with all her teeth and her ears open. She ready to do her little show. Her una sugar only can you imagine the one sugar only lasts for 5 minutes. How long your show gonna last for today? 100. How much? 100 minutes? 100. Oh, so your show gonna last for 100 minutes. And her, trust me, her own show is just pre-recorded show, so don't worry about it. You can even find her show on all her show is just pre-recorded. So we about to end this program now. Then we're gonna go into a Zora show. It's called Fun Time. Fun Time. So We want to say to all of you who joined us here, we want to say thank you for joining us. It was a pleasing pleasure to be here to serve you again, to always serve our community. And we look forward to seeing you guys again next time. So we want to say bye-bye and have a good evening. And Zora about to do her phone time. I know somebody wants to see her phone time flyer. Let me pull a phone time flyer so you can see what I'm talking about. I know somebody be like, oh, Zora phone time. Can we see Zora phone time? Come on, girl. You laughing? Hold on. You live, so you better be careful because people are going to see your teeth, and when you grow up, your teeth going to be on YouTube forever. All right, so this is Zora Funtime flyer right here. So this is a show she can be doing in the background here. It's called Funtime with Zora. So it's about a whole lot of things about the age group, talking about a school spelling words and doing all kind of yama. So she about to start her fun time here. So I want to say thanks to everybody who joined us here. It was a pleasing pleasure to serve you. My name is Philip, and you guys got to see Taylor Logan. And I want to use this time to say happy birthday again to my dear little brother Hezekiah Bishop Tutu Mira Logan. Now I want to also say happy anniversary to Mr. and Mrs. Sion. We wish you Godspeed. All right. So until we meet again, we want to say bye-bye for now, and good night to everybody who follow us here. Good night. We look forward to seeing you.